We all know how important it is to protect our respiratory health. Breathing is something we often take for granted, yet it is essential for life. Many viruses can affect our respiratory system, and some are more well-known than others. One such virus is the Human Metapneumovirus, or hMPV for short. This common respiratory virus often goes unnoticed, but it can cause a range of illnesses, from mild, cold-like symptoms to severe respiratory infections, especially in vulnerable populations. Understanding hMPV is crucial for protecting ourselves and our loved ones. By learning about its symptoms, transmission, and prevention strategies, we can take proactive steps to stay healthy. This essay aims to shed light on hMPV and empower you with the knowledge to safeguard your respiratory well-being. Discovered in 2001, hMPV is a relatively new virus compared to other respiratory viruses like influenza or RSV. Despite its recent discovery, research suggests that hMPV has been circulating in the human population for many years, often mistaken for other respiratory illnesses. hMPV is a single-stranded RNA virus belonging to the family, which also includes the respiratory syncytial virus, RSV. It primarily infects the cells lining the nose, throat, and lungs, leading to inflammation and irritation. While hMPV can affect people of all ages, it is particularly prevalent in young children, the elderly, and individuals with weakened immune systems. hMPV spreads easily from person to person, mainly through respiratory droplets released when an infected person coughs or sneezes. These tiny droplets can travel up to 6 feet and infect others if inhaled or deposited on mucous membranes like the nose or mouth. Direct contact with contaminated surfaces can also contribute to hMPV transmission. For example, if an infected person touches their nose or mouth and then touches a doorknob, the virus can survive on that surface for a period of time. If another person then touches that surface and then touches their face, they can become infected. The virus typically spreads most rapidly during the winter and spring months, similar to other common respiratory viruses. However, hMPV infections can occur year-round. Section 4. Recognizing the symptoms, from mild colds to serious respiratory infections. hMPV infections typically manifest with symptoms similar to those of the common cold, making it challenging to distinguish from other respiratory illnesses. In most individuals, especially healthy adults, hMPV causes mild, self-limiting symptoms. These include a runny nose, cough, sore throat, congestion, headache, and low-grade fever. However, in young children, older adults, and immunocompromised individuals, hMPV can lead to more severe complications. These complications may include bronchiolitis, an inflammation of the small airways in the lungs, pneumonia, an infection of the lungs, and croup, a viral infection characterized by a barking cough and difficulty breathing. Section 5. Diagnosis and treatment. Managing hMPV infections. Diagnosing hMPV infections can be challenging based solely on symptoms due to their similarity to other respiratory illnesses. To confirm an hMPV infection, healthcare providers typically rely on laboratory tests. The most common diagnostic test is a nasal swab, in which a healthcare provider inserts a long, thin swab into the nose to collect a sample of respiratory secretions. This sample is then sent to a laboratory to detect the presence of the hMPV virus. Unfortunately, there is no specific antiviral treatment available for hMPV infections. Management primarily focuses on relieving symptoms and supporting the body's natural healing process. Over-the-counter pain relievers and fever reducers can help alleviate discomfort, while staying hydrated is crucial for thinning mucus and preventing dehydration. In severe cases, hospitalization may be necessary to provide respiratory support such as oxygen therapy or mechanical ventilation. Section 6. Prevention and future directions, protecting ourselves and future generations. Preventing hMPV infections involves adopting similar measures as those recommended for other respiratory viruses. Good hand hygiene is paramount. Frequent hand washing with soap and water for at least 20 seconds, especially after coughing or sneezing and before eating, can significantly reduce the risk of infection. If soap and water are unavailable, alcohol-based hand sanitizers containing at least 60% alcohol can be used as an alternative. Covering coughs and sneezes with a tissue or the crook of the elbow helps prevent the spread of respiratory droplets. Avoiding close contact with sick individuals and cleaning and disinfecting frequently touched surfaces can also minimize the risk of infection. While there is currently no vaccine available for hMPV, research is ongoing to develop effective vaccines and antiviral treatments. Scientists are actively studying the virus's structure and behavior, seeking targets for therapeutic interventions. By staying informed about hMPV, practicing preventive measures, and supporting ongoing research efforts, we can protect ourselves and future generations from this respiratory threat.